I'm Mary Pepino, and welcome to Fit for You, the show that teaches you how to live a healthier and more fit lifestyle. Interesting topic today, lifestyle medicine. You're going to be hearing a lot about it, and it's very interesting to me for two reasons. A, lifestyle can be one of the best medicines we have going for us. Picking the right foods, being active, getting our bodies out there and moving. The other interesting component of lifestyle medicine are the medicines that have had to be created to help us combat the diseases and illnesses that we're causing from poor lifestyle choices. So it's an interesting topic. We're going to be joined by my dear friend, Dr. Michael Lileas, and I hope you enjoy the show. It's my pleasure to welcome back my dear friend and one of our finest physicians and a fave of Fit for You, Dr. Michael Lileas. Thank you for coming back.
Thank you for having me back.
And let's read your credentials to remind everyone about what an outstanding resume you have, dossier. Founder, Salem Internal Medicine. Board certified in internal and sleep medicine now. You are the hospitalist at Southwoods Surgical Hospital.
Correct.
You are an assistant professor at NeoMed in internal medicine. You are a consultant for Delta Sleep Labs. And it just goes on and on. Instead of slowing down, you go in the other direction, and I love it.
Well, don't worry about it. I will slow down eventually.
But you know what's great? Because it keeps you, I love talking to you because you're so on top of everything that's going on in so many areas.
You know, really, I think the students are what keeps you up.
So true. They keep us young, and they keep us, we have to be on top of our game or we lose respect.
Absolutely.
Absolutely true. I want to talk today about medicine and how you've seen it evolve and how we have evolved from when you started in medicine back in 1990. I would think that there was a lot more illness that we couldn't necessarily avoid. So medicine was more focused on treating that type of illness. And today, thanks to industrialization and a few other things, our lifestyles have gotten rather poor, our lifestyle choices. So now we're making ourselves sick, and medicine has to respond to make medicines to fix what we're actually breaking through a poor lifestyle.
Well said. I mean, that's very well said.
Thank you.
And, looking back over the years, since 1990, and I can even think back into lectures in medical school when they were talking about high cholesterol, high triglycerides. And, now we have all these different drugs that are available, these different statins. There must be at least 5 statins out there, plus other medication that is available, for the treatment of hyperlipidemia, or high cholesterol and high triglycerides. Well, back then, there was only a couple drugs. And most of the time, they were using what they call cholesterol resin bile acid extracts, things that bound up cholesterol in the gut. So when you would eat it, it would bind it up and then it would come out. But now they have all these different things that work through the liver, and they still have some that do bind up cholesterol in the GI tract and, help to get rid of it. But it has changed so much with these medications. The first couple of statins that came out, back in the 90s, and to show you how different it was, we would have to put somebody on one of these medications. And then 2 weeks to 4 weeks later, we'd have to check their liver enzymes because these statins work through the liver. So we'd have to check liver enzymes to make sure they're not going up too much. And they gave us guidelines as to what was too much elevation of the liver enzymes. Then we'd also check the cholesterol at that time to see if, are they working after 2 weeks? Most of them didn't work after 2 weeks, believe me. But the liver enzymes could go up after 2 weeks. So depending upon what they were, then you would repeat the liver enzymes, the cholesterol at 3 months, then 6 months, then 9 months, then 12 months. And after a year, if the liver enzymes weren't going up, then you could cut it down to twice a year. Now they say you don't even have to check the liver enzymes. That's how good these statins are. But as you said, we have changed lifestyle, and with inactivity and obesity being so predominant, that we have had to make better drugs to treat cholesterol, to treat diabetes, to treat obesity.
Well, and let's start, because I think obesity and diabetes first and foremost has, as I understand it, doubled and is soon going to be triple what it was about 25, 30 years ago.
Right. And
all lifestyle induced, by the way.
Yes, and I was reading some online articles by your friend that you showed me that book, Dr. Hyman.
Yes.
That's a good. I'd like to read that book, because this guy sounds like he really knows what he's talking about. And it sounds like he came out maybe just a little bit before me, and I was reading about his biography and, the things that he did. He comes out, he goes into residency, gets out of residency, he's working part-time in various emergency rooms, plus he's got his practice. And, he doesn't have time to eat, doesn't have time to exercise, barely spends time with the kids. And so he said, I got fat, and then my cholesterol went up, and, then he finally realized that I'm doing this to myself.
Exactly.
Okay, now things are starting to click for him. So then he decides, I have to look at this. And he started looking at various things that people were doing at the time, like when Dean Ornish came out with his diet. That's big, and that's still big today. There isn't, except for Esselstyn. He, between him and Ornish, those two have just changed the face of diet.
A very similar type of work focused on heart disease. And their theory of no fat. Now, I think if you get to the point where you need to reverse heart disease,
absolutely,
then I think that's important. Me personally, I like some of the good fats, and we can talk about that. We can get into that a little bit. But you're right. They changed the face of saying you can now reverse some disease through diet and lifestyle, and depending on what it is, making certain changes.
I also like the one term that he used, diabesity.
Yes.
I mean, how true is that?
Absolutely.
Obesity and diabetes. Absolutely, the two go together.
And we're seeing it in children. Because if the parents aren't following a good diet, and I use the term diet to mean eating plan, not diet to lose weight. If the parents aren't following a good eating plan, and there's a lot of fast food, and there's a lot of refined processed food, and there's a lot of, non-nutritious snack foods, then it trickles down. It trickles down to a pregnant mother. Isn't necessarily nourishing maybe the baby as well as she could be if she was eating a healthier diet.
Absolutely. And, maybe that's why sometimes we see this gestational diabetes or this blood pressure issues with pregnancy.
Yes.
Because of diet, because of lack of exercise prior to the pregnancy. And then what are you going to do? Are you going to expect them to be like that one girl that's Olympian? She was 8 months pregnant, still running 12 miles a day, 3 days a week. Well, if somebody wasn't even walking prior to that, they're certainly not going to start a running program when they're pregnant.
Absolutely.
So another thing I found interesting about his work, and there was a couple of other ones, I think, in another article that you sent me, but they talked about, 20 years ago, the only people that were really doing this stuff with diet was like Dean Ornish.
Yes.
And nobody really, I mean, people weren't paying attention, especially doctors. And, I'll clarify that. It's especially doctors. Because we don't like new things. We don't like to have to change things. And we like steak and potatoes. So when you tell someone who was raised on steak and potatoes, you got to change. You got to start doing a lot of things with plant sterols. You have to use different types of fish with these wild game.
Right.
And not so much on the meat and potatoes.
Right.
Well, if a physician's not going to listen to that, are they going to tell their patients?
Exactly.
Absolutely not. They're not going to tell their patients because they don't believe it themselves.
Right, and when you were going to medical school, and it is in 19 when you were started, and then, when you got your first
82,
certification, 99, early 90s, medicine was geared, and how much can you do in, even though you're in school for so long, how much can you cover? The body's so complex. It was to treat disease and illness.
Right.
It wasn't necessarily to prevent it or to find the root cause of, well, let's see, you have obesity, you have diabetes, you have heart disease, and start to look at the whole picture on what's the root cause, of the whole body. It was like, okay, you have one problem, we'll treat this problem. Then there's another problem, okay, now we'll just focus on that problem. We weren't looking at the root cause of maybe there is a common denominator and lifestyle, and what can we do before we turn to medicine.
And really, I think you hit that right on the head, the lifestyle. I mean, I can remember back in medical school, the first couple of years you didn't have a lot of issues with diet and exercise and talking to you about how do you do this with patients. There was none of that. The closest thing I could think of that we talked about back in medical school was, okay, the first thing you do if somebody has high cholesterol, or the first thing you can do if somebody has sugars that are mildly elevated, and really back then, a fasting sugar of 140 was considered normal. Now it has to be below 100 to be considered normal. So that's a change. So now you're looking at, okay, you want to do lifestyle changes. They never told us what those were. They never said, here's what you do. This is what you talk to the patient about. You got to talk to the patient about exercise. You got to talk about the patient, what type of diet do you want me on, doc?
Right.
You can't just say, hey, go on a diet.
And there is no one diet for everybody.
Absolutely. Right.
Everybody needs to personalize it for themselves. Well, and I'm going to bring up another point. Even, it hasn't been all that long, but when I was growing up, I wasn't playing a video game. I mean, everybody in the neighborhood had a bicycle.
Right.
Everybody was walking and playing outside, especially, between spring and the end of fall. I mean, our lifestyles were so, and my mother cooked dinner 5 or 6, if not 7 nights a week. So even though you might not be eating, low fat, so to speak, or everything was sourced, and now food sources are very important. They were more natural. We didn't have a lot of chemically refined and processed foods. Our foods, my mother would go to the grocery store, as most mothers did then, or most parents did then. I, hate to sound like I'm being sexist, but it was a little more, I would say, the mother at that time. But anyway, families were getting around a dinner table, eating dinner together and eating real food.
Right.
If we had sweets, my mother was baking a cake, making the cookies. And God forbid my grandmother, nothing came out of a box. Her job was to cook from scratch.
Yeah, I mean, you think about how you were raised and how many gardens were on the street.
Oh, absolutely.
Everybody had a garden. If you didn't have the salad for the table, you went over to your neighbor, say, do you think I could borrow some salad? And it's all fresh.
Right.
It's fresh stuff.
Right.
And it's organic.
Yes.
It was if your uncle had a garden, he had a compost, and you used anything that was considered waste, garbage, was put in the compost. It wasn't put in a plastic bag and sent to the dump. It was used, it was
Right.
reused. And that's how I think we got such good food as we were growing up.
Yes.
But now everything is either processed, or you have some of these producers who have farms where the chickens, the cows, they're fed antibiotics, they're fed steroids, they're fed who knows what.
Right.
And now we don't know how is that passed down to us.
Right.
Because it is. It's passed down to us. We may just not know how some of that has affected us until time goes on. And now we're finding out these things. So now you got all these people, like 20 years ago they said, here's, therapeutic lifestyle changes. Just tell them go less than 20% fats and watch the carbohydrates, and that was your diet advice. Well then, about 10 years after that, then some people start actually looking. They start doing studies and actually looking at people. Well, what happens? Framingham comes out with this big study. Well, people who do this, have this cholesterol, smoke, don't exercise, their risk of heart disease is X over 10 years. And they were pretty right. But again, it got to the point, well, what do we do then? What do we tell them to do? And part of the thing, I think, with physicians, especially the primary care physicians, because they're usually the only ones that care, they still didn't tell us, what do you tell patients to do?
If we look at how plates have gotten bigger,
Oh, yes.
and even restaurant foods have gotten much bigger. So what you thought was a big portion growing up, I'll bet you was probably about 4 to 6 ounces. You just didn't realize it.
That's probably true because, there was 8 of us growing up, so you were fighting for every last morsel.
Right. And think about this too, because I know what one night you had, if you had, like pizza, one night you had pasta, I mean in our household, okay?
Right.
And we'd always have a salad and a vegetable and whatever. But, roast beef was one night a week, but that was a big deal when my mother made a roast. We
Right.
weren't eating steak and roast beef every night. When we say meat, it was maybe in a soup or maybe a nice lean pork piece of a pork chop. Or, when you really stop and drill down and think back to it, it was a very different approach than what we think of today.
Oh, absolutely. I mean,
And now we have to go to extremes to the point where we have gotten so out of whack that we have to tell people, really, we've done such a poor job of with portion control, like with meat, for example, and I think a little bit, too, of where it's sourced from. Because, like you said, and the industrialization of food has tried to duplicate most cost effectively as much as we can. Let's take a cow, and how much can we get out of the cow between the milk and the whatnot and so, right?
Yeah,
and the pigs
absolutely.
and the chickens. How many eggs can we get them to lay, and how big can we get them so that we have an even bigger chicken, right?
right. And, and what effect does giving these animals hormones and antibiotics affect the end point, the humans, us?
Right, we ingest it. It's no different than if you're a pregnant animal, if you're a pregnant mother, if you're a pregnant whatever, what you're ingesting, isn't that nourishing the baby?
Correct.
So if you're taking in, chemicals, so to speak, and the antibiotics and whatnot, it has to be affecting the food and the result of what's being produced.
Correct.
I have a question for you. Knowledge is power. And diabetes, as we started to say, is so important. Can you give us a little explanation of what happens when we ingest a food that is very bad for us, like plain refined white flour that makes our insulin levels go up, or sugar and refined sugar and sweets and things like that? Explain to us what insulin is and what happens to the body, because I think when people understand what it does, that maybe that'll help them to think about, gee, I really need to think through, is it really worth eating all of that? I can eat it once in a while, but I have to refocus what the majority of my diet is.
Okay, so think about your carbohydrates, your sugars, and what happens. They're considered our energy. Okay. The problem is that some of the things they do, especially if you, for instance, take in too much carbohydrate, too much sugar early in the morning.
Now, simple carbohydrates.
Simple.
So let's explain.
Right.
Simple being, go ahead.
So simple, like simple sugars,
Anything white.
potatoes, white bread. So all these simple type sugars. So, and a lot of people, what do they do first thing in the morning? They have some cereal, they put some sugar on it. They have toast, it's white bread.
Donuts.
Donuts. So what happens in our body is our pancreas will produce insulin in response to this surge of sugar.
Now, what's insulin?
Because all of this that we take in gets broken down and becomes sugar.
Okay, and tell them what insulin is.
So insulin is a hormone produced by the pancreas. And what happens is this insulin allows us to utilize the sugar as energy source. The problem is that normally what happens is you're supposed to take in so much carbohydrate, so much bad sugars that during the day that your insulin level should remain steady. But the problem is now we're starting the day with an insulin level that goes way up here. So what does that do? It makes us hungry because insulin makes us hungry. It also helps your digestive tract produce another one of these hormones that causes hunger. And so now you got the hunger. Now it also, what else does it do? It increases your cortisol level. What's that do? Make you hungry. So now you want to eat more. So if you eat more, what happens? Now your insulin's going to go up again.
And 9 out of 10 times, now they go make another choice
A
of
snack.
something that's easy, refined, processed. Let me go to the vending machine. Let me grab a cookie. Let me grab, a slice of, even if it's whole wheat bread. If it's just plain whole wheat bread, 9 out of 10 times it's not whole grain. It's like eating a slice almost of white bread.
Oh, probably. I mean, I'm sure that in the majority of people that this happens to, that's what happens.
Right, so now we're eating
So now
another.
here's your insulin level. Your insulin level stays up here all day. Well, so there is some theory that, okay, well, how long can you keep your insulin level up there and just keep adding more sugar and more glucose into your diet and still not be a diabetic? Well, the question that happens, or what happens is, this insulin, now it doesn't work in some people, especially the type 2 diabetics. Now this insulin doesn't work. It doesn't help you utilize that glucose as an energy source. So you become resistant to the insulin. So that's usually our first step, what they call metabolic syndrome or pre-diabetes, is your insulin doesn't work like it used to. Now, is that because you've, pounded your body with carbohydrates and sugars and you've kept your insulin so high that you wore it out? It's not working anymore. Maybe your pancreas doesn't want to produce it anymore. So what do you got to do? Do you stop carbohydrates completely? Do you stop ingesting sugar completely? No, I don't think you can do that because you still need part of it as an energy source. But what you got to figure out is how to get your insulin working again. Now, that's where some of these other, like you were saying, you have to have a medicine invented because you destroyed this. So that's where they come out with this metformin to try and improve the way your body utilizes the insulin. So in someone who's a pre-diabetic, one of the first things the physicians always reach for is metformin, because they figure that if we can get the pancreas working again and the insulin working again, that we can improve this pre-diabetic and maybe prevent them from becoming a full-fledged diabetic.
Now, do you agree that they've got that choice, but they also have the choice, if they would eliminate the simple carbs, they would get onto a good eating plan where they're nourishing their body with fresh fruits and vegetables, whole grains, lean proteins, good fats, avocado, olive oil, walnuts, seeds, chia seeds, different things like that. And they're eating every 4 hours. That they can correct the problem themselves most of the time. If you have a genetic propensity, that's a
Right.
different story. We're talking about a lifestyle-induced diabetic.
Right.
That should be the first step, because there is no medicine out there, no matter how good it is, that's going to work that well, because every medicine you take, it may solve one problem, but there's always going to be some side effect, something you have to
Right.
be careful of. You don't have any bad side effects with good food and activity.
And again, I think that's where this goes back to, why do physicians reach for metformin for a pre-diabetic or somebody with metabolic syndrome versus therapeutic lifestyle changes? Because we weren't taught.
Well,
What are the therapeutic lifestyle changes that we need to do? And that's where we need to be educated. And even even physicians need to be educated about therapeutic lifestyle changes, what they are and what they can do.
And people, you have to convince people that the time and energy and effort is worth it. Because
Correct.
it's hard
Correct.
when a physician says it, it carries a lot more weight. But if a physician tells you, I can give you this medicine, but let me explain to you what the negatives are versus if you're willing to try this. Now, somebody's got to have the time. See, this is where I think the system breaks down a little bit. To me, it's a combination. That physician is at the top of the pyramid, like the CEO. Then you've got to have his little team of people to help him, because to say, okay, we're going to educate the patients on, okay, this is how you need to eat better in your particular case for this. And then we need to give them an exercise person to help them say, let's figure out a good exercise program for you, that even so you can get some movement in 3 or 4 days a week. And then you want to make sure that you have a coach for them to keep them focused and doing, because in all fairness, the poor doctor, can't manage it all by himself.
Correct. And especially, if the physician was never really trained in, dietary or nutrition.
Yeah.
But then what happens is, again, and I think this is part of the breakdown too, is, they want to have these accountable care organizations where the physician leads this organization, which is a team of physicians, nurses, maybe physician assistants, medical techs, that all the people that can help and teach people nutrition, what to do, how to exercise. Not just say go out and exercise 20 minutes 3 days a week, but here's what I want you to do. I want you to do this. And each of that has to be individualized, because, maybe you have a 70-year-old guy who's got some back problems, and you got to make sure that what you're telling them to do isn't going to make things worse.
Right. Absolutely. Absolutely.
Yes.
You're a teaching professor, internal medicine. Do you talk to your students a little bit about lifestyle?
When I was in the hospital teaching on the floors with the residents and the students, I did. Now I'm sort of limited. I'm only teaching a certain thing like sleep and
We're going to sleep
EKGs
next.
and EKGs. That's all I teach the students this time.
Okay.
So, but when I was making rounds on the floors with the residents and the students, we would talk about diet. We would talk about, what could we do to make this person better? If it's a post-op patient, are we going to start the diet early? We don't want to keep these tubes in them all this time, because all we're going to do is cause problems. So, yes, I did at that time, but at this time, I don't really. Although, I'll take that back in a second, because I have a daughter in medical school, and I talk to her a couple of days a week, and I'm surprised at the things that she is learning, the things that I know I didn't know at that time in my career. When I was a first-year medical student, they never talked to us about this. And she already knows all this stuff already. I'm thinking, oh my God.
That's great to know.
It is. It's a lot of it is based on the patient, not so much on the physiology, but the physiology makes sense to her because they explained why it did this. Why did the pancreas do this and cause this? When they explain that sort of thing to the students, it sticks with them a lot more.
What's Megan's specialty? Is she going to go into internal, do you think?
I doubt it.
Okay.
I think
She'll
she'll
go into a
want to go
specialty.
into anesthesia or
Let's talk a little bit about Mara.
radiology.
Let's talk about your older daughter, because she is a phenomenal young woman.
Right.
Who is very accomplished, and she has a very strong passion for yoga.
Absolutely.
And it's changed her life.
Certainly has.
Is she a vegan now totally? Last time we had dinner, I think she was vegan.
She has been vegan for 10 years. The only thing she started to eat lately was she will rarely have a little piece of salmon.
Okay.
Wild salmon. And she'll have egg whites.
Because I was going to say, I think she had, that's where I think she deviated a little bit that night with eggs.
That's the only thing, but in the past 10 years prior to that, it was strictly vegan. And plus yoga, she's healthy as could be.
Well, and she's very interesting because I so envy her, because now she's doing an extensive study outside of the United States. She has acquired such a passion for yoga, and yoga is becoming the #1 source to alleviate and manage stress, to focus on getting into the right mindset so that then you can adopt and think about how you're going to live a healthier, more fit lifestyle. So, she's got an amazing career.
Excuse me.
That, and I think an amazing career ahead of her that's going to link very well into the medical arena.
And I really, I think you're absolutely right about that. When I had back surgery, she, would always tell me there are some yoga things that you should do to strengthen your core, to help your back. And she's right. Well, I know when I do these things that it makes me feel better. And, it's just training yourself to continue to do that.
It's funny. The things we're talking about today, and we're going way, way back in history, when people thought you were crazy. And I think it was Hippocrates who started to talk about, food can be medicine. And my God, the yoga practices go back to, very, very ancient times. And we're finding out that a lot of these theories that focus on the body and the self, that we got away from when we got into this, society where, everything had to be done yesterday, and, technology, and I love technology, please don't misunderstand, but it's taken us so far away from the introspective self. Because we're always afraid we're going to miss something. You gotta have that phone with you, because you can't miss a phone call, you can't miss a text. You got to know what's going on with everybody else. We're connected to the world 24/7.
Right.
It's unbelievable.
Yeah, I mean, that's...
When do you shut it off? God forbid you shut it all off for an hour.
I would like to shut it off every day, to tell you the truth.
Right? I love, like when I'm on an airplane or something, and I can't get a Wi-Fi and I can't do, I'm like, you know what? I can just sit here and read and relax because there's nothing else I can do for the next couple hours.
Mode, forget it.
Yeah. It's made, that is probably the best part of travel right now.
You're probably absolutely right about that.
Hey, we have to talk about your other area of specialization because you are one of the few in the country. How many are board certified in sleep right now?
In the country, we do have several thousand, but it's not like any other specialty. We don't have as many as other specialties do.
It's new.
It probably started around 1985 was probably a good time.
Oh, really?
Mm-hmm.
So.
But even back then, like when I was in medical school, okay, I was in medical school from 82 to 86. I don't remember anybody mentioning sleep apnea or narcolepsy or insomnia other than to say people don't sleep.
Yeah, don't have coffee before you go to bed or Coke. Just don't drink
caffeine. Now there's so many different aspects to it that are coming about. And I have to laugh because even when I first started studying for boards and first started with sleep, which was about 8 years ago, circadian rhythms, which are part of the rhythms that keep you awake and keep you asleep. Keep you awake, keep you asleep. So it's a two-part system. If you talk to anybody and say, well, your circadian rhythm's probably off. You probably, especially like young kids in high school, they stay up too late on the computer and sleep in the morning because they're too tired to get up. Okay, that's part of their circadian rhythm. So if you were to talk to people about that, they'd look at you like, what? Like you're talking a different language. Well, now I look and I see commercials on TV. We can help you with this non-24. And I'm not sure if people realize they're talking about a circadian rhythm. And, especially in someone who's been blind since birth. They don't have this circadian rhythm because they can't see. Especially if they have no light reflex at all. They don't know whether it's day or night.
What's define a circadian rhythm?
So circadian rhythm means it's the part of your brain that shuts off during sleep and goes on when you're awake. Okay, that's oversimplified.
But I like that because now let me ask you this. Does daylight affect, can you turn it off even when it's daylight if
you can affect it. If you go into a dark room and darken everything to the point where it seems night to you, then there's certain hormones that come into play and certain neurotransmitters that come into play in darkness. So yes, you can fake out your circadian system. And, and it happens in people, like I said, who are blind or who've become blind from trauma, and it may take them longer to get to this place, but why they call it non-24 hours, because they don't know whether there's a light or a dark. It's always dark to them.
Well, let me ask you about lifestyle medicine a little bit. So how many times do you think someone would prescribe or recommend for someone? Let's say, I can't go to sleep, or I work a job where I'm working in the evening and I come home in the day. So many people I know, when they have an issue with sleep, first thing they want to do is, I got to pop a pill. I'm going to pop a pill to put me to sleep, or I'm going to pop a pill so I can stay up longer, or I'm going to drink 10 Red Bulls, which is insane in my world. But anyway, the point being, there are things you can do, like you just said. There are lifestyle changes. Go dark in a room, shut all the blinds and everything. You don't need to go pop a pill. Think about getting yourself in a mental frame of mind and creating the atmosphere that will help you to achieve what you want to achieve. It's not just about, take a pill.
And really, the people who just want a pill to sleep, after a while those pills don't work anymore. So you can increase the dose. But then after a while, that doesn't work, so you have to increase again. Then what are you doing? Then you're switching pills. Then you're trying something different. But basically, like you said, you're not getting to the root of the problem. The problem is, hey, you know what? I work the midnight shift. I get home at 8 o'clock in the morning. It's light out. So this light is telling my brain I got to stay awake. So what can we do to help prevent that? Well, we can't get rid of the sun, right? But what we could do is
we don't have enough
we
of it
don't
as it
see
is.
enough of it in Ohio. But what you could do is on the way home from work, wear dark glasses.
Oh.
Go straight into the house. You know, try not to eat a big meal before you go to bed. And then darken everything. Darken the room. You know, make sure you're tired. Most people who work a midnight shift, they are tired when they get home. But some people, maybe they're not. Maybe they drank too much coffee or had a Red Bull or something before they finished their shift. So they have to make sure that stuff is out of their system. Go read a book for a while until you're tired.
We take pills to, instead of listening to our bodies, if you know, it's like, I don't want to be tired, so I will artificially ingest some type of caffeine or something. So now I'm not going to listen to my body to be tired. I got to get up. So now, you know, I got to keep going. Or now I want to be tired. Okay, well, let me take a pill to make me tired. I have heartburn. Don't let me think about what I'm eating that might be giving it to me. Just give me a heartburn pill.
Yeah, you just
I'm like, it's like everything, the world just, I mean, I shouldn't say that, but too many people want that simple solution. And I'm hoping if they walk away with nothing else after watching today's show, that they think about, hey, let me think about what I can do first, maybe. Consult with your doctor.
before I take the pill.
Right, exactly. I want to talk to you about sleep apnea because I'm very, it's amazing to me what I've seen people do, and we even did a whole show on it about a year ago with the CPAP and all of that. But is it fair to say that the majority of sleep apnea, or a good part of it, is lifestyle induced? Because if people can lose weight and you know, get some activity into their life, doesn't it have a positive impact on sleep apnea?
Yes. Now, the big question is, have I seen people who have a normal BMI still have
Body
sleep
mass
apnea?
index?
Still have sleep apnea? Yes. But there are exceptions. Those are the exceptions. Most people are, as you suggested, they're obese, mild, moderate, or severe. They don't exercise. Maybe they're smokers. Maybe they drink too much alcohol. And again, more than 2 drinks a day for men, 1 drink for women is too much. So if you could get them to change those things, then maybe you could get them to either improve their sleep apnea or get rid of it. Because I've seen patients who have actually gone through bariatric surgery, had the gastric bypass, had sleep apnea prior to the gastric bypass, and then after they've lost 90 or 100 pounds, recheck them, they're either coming off the CPAP or they've cut down from 20 centimeters of pressure down to 10 or 5. So yeah, there is great improvement you can do with lifestyle changes.
And the CPAP, if I'm correct, it brings oxygen into you, because what happens at night when you have sleep apnea? You're not taking in the proper amount of oxygen?
What happens to most people is they will stop breathing for periods of time. And normally, to be considered an event, it has to be at least 30 seconds long. So just think about it. 30 seconds long, you stop breathing.
Hold your breath for 30 seconds. That's a long time.
So now that happens, you know, if you're mild, it happens between 5 to 10 times an hour. If you're moderate, it's for like 11.
5 to 10 times an hour.
It's like it's 5 to 15. So, and for moderate, it's 15 to 30 times an hour that you stop breathing for anywhere from 10 to 30 seconds at a time. So that means every time you do this, your oxygen drops. Now think of the severe people. The severity is 30 times an hour.
Wow.
So now think about these people. They stop breathing. So what happens to them in the morning? They feel like they never went to sleep. They're so tired they can't even function.
So why does losing weight affect my sleep pattern that I stop breathing in the middle of the night? Why, when I lose weight, do I sleep better? And then I want you to also answer this question too, because that's the extreme if you've had gastric bypass. But wouldn't
Correct.
losing 15, 20, 25 pounds even help you?
Yes, but it probably won't take it away.
Okay, but it'll help.
Yes. See, part of what most of the people that with sleep apnea, especially if they're laying on their back. So they're laying on their back, and what happens is their tongue falls in the back of their throat, pushes several of these muscles back against the airway. When it does that, that's when they stop breathing.
Does it happen
That's
to me when
their
I sleep on my back?
Probably not. You're too muscular.
Oh, okay. Yeah, because I was going to say, I don't think my tongue falls back. What makes your tongue fall back?
Well, part of it could be because these muscles back in here, they're not real strong, they're not real sturdy, and so when you lay back, they just flop back. And that's why some people, like I said, could even be thin, but their muscles in here, maybe they're smokers or something, and their muscles in here are not very strong, so when they lay back, their tongue just falls backwards. So what do they tell some of those people? Lay on your side. Because then your tongue won't fall back. And wear something that keeps you from rolling over on your back. Mm-hmm. They do that. I mean, that was a treatment in the beginning, that this is what they did, keep people on their side. Mm-hmm. And, again, it works to some extent for some of these things, but, if you're talking about somebody who has severe sleep apnea, 30 times or more an hour they stop breathing, or their oxygen drops by 3% or 4% now in the guidelines, 4% or more, then you have to fix that. Because if you don't, then what happens, especially during your restful sleep, your REM sleep, where you dream, what happens is your sympathetic and parasympathetic nervous systems are kicking in back and forth during these times. So what happens if you stop breathing, then what happens, your sympathetic nervous system wants to kick in, but the parasympathetic's going to win, and what happens is your heart rate goes up, your blood pressure drops down, and then after you stop and go back into a normal breathing pattern, then your sympathetic kicks in really high, and your blood pressure goes way up.
Not good.
So, well, the problem is that is when heart attacks can occur, or strokes occur during those apneic episodes or right after the apneic episodes. So that's why you really have to treat these things. People think that I'm just wearing a mask just because I snore too much. I mean, really, that has no, snoring makes us think about it because it's a noise, right? And we hear that noise, hey, what's wrong with you? You stop breathing or something? So, but the problem is the underlying mechanisms that happen could be devastating. Could be stroke, could be heart attack, could develop an arrhythmia of the heart. So there's a lot of different things that could happen that are deadly. Think about how many times have you heard, oh, this person was very obese, severe obesity. Their BMIs were over 40, and they all of a sudden didn't wake up one morning. Probably because they had a sudden cardiac death during the night from sleep apnea.
But because the rest of the body is in such poor condition and poor health from a poor lifestyle, correct?
Correct.
Hey, we have to talk about one more thing because knowledge is power. So if you can influence even one viewer to quit smoking, You'll be my hero because I'm like the anti-smoker now. Like that's one of the things that's even I would love to just see everybody stop smoking. So when people are smoking, just can you give them a quick overview of when what they're taking in and what it's doing to their body?
Well, the biggest problem with smoking is you don't know what you're taking in. You know you're taking in nicotine, which is going to stimulate your brain, and that stimulation is going to stimulate your heart.
And pollute your lungs.
And pollute your lungs. The problem is what is the other stuff that's in with that nicotine? The tars and all of the different chemicals that are made with the cigarettes. What happens to those chemicals in the lungs? Well, your lungs try to filter them out, but the problem is sometimes the lung doesn't filter them out. So that's why you end up, you see, if you ever saw an autopsy result of someone with emphysema, it looks like they got black lungs. Because that's what happens to it. It's like your furnace filter. At the end of the year,
great analogy.
That furnace filter's so black, if you don't change it, what happens? The air conditioner doesn't work as good in the summer. The furnace doesn't work as good in the winter because the air doesn't get through.
And that's perfect. And you can't change your lung filter unless you stop smoking,
so
right?
So change the filter on it, and that's what happens. But like you said, we can't change the filter on our lungs. The only thing we can change is the lifestyle that got us there.
And that will clean out
Correct.
the lung if you quit the cigarette.
You can see improvement in lung function. And even, in your lungs you have these little hair fibers called cilia. And what the cilia does is it takes the bad chemicals, the bad things that you inhale in your lungs, and it pushes them out so that you cough these things up. Like when you're sick and you have a cough, you have bronchitis, well, that cilia is trying to help you get rid of that stuff. The problem is when you smoke, those cilia burn. And so now instead of having 1,000, let's just say 1,000, you got 100.
Do they grow back?
They will. They will grow back.
If you don't stop smoking, they don't grow back.
If you don't stop smoking.
So eventually you'll have none.
Right.
So now you have all this pollutant.
Now you got all this mucus that builds in there. So why do certain people with emphysema get pneumonia? Because all this mucus doesn't come out. They can't get it out. And what happens, so the lungs are trying to do, in some people, they kind of shorten up a little bit, and some people, they get longer to try to make more air. But the problem is, in certain types of emphysema, you can't get the air out. The air comes in, it gets trapped. So the lungs start enlarging. So now you got these big lungs, well, they don't work worth a darn. Because the air gets in, but you can't do anything with it. You can't push any more out. So now you're short of breath because you took this big breath in, but now I can't push the air out to get another one. So there's just a lot of things with smoking that unfortunately is going to kill you eventually. Whether it's heart disease that becomes from it, or whether it's emphysema or lung cancer or some other cancer associated with smoking. There's at least 10 different cancers associated with smoking. So there's no,
And the cigarette smoke, eventually, it gets through your whole body eventually. I mean, there's no way you can, you've got that dirt in there in the lungs. And then through your vascular system, doesn't eventually it get transported around?
Is it, it increases like for instance, your carbon dioxide in your blood. So that's one of the, types of chemicals that you want to get rid of. Well, you're increasing it. So, this can cause damage to the inside of the blood vessels. When it causes damage to the inside of the blood vessels, then what happens is, say for instance, you developed shortness of breath and you can't get the air out. You can get some in, but you can't get it out. Well, your carbon dioxide levels go up, you damage the vessels in your heart, or damage the vessels in your neck, the carotid arteries. And when you damage those vessels, now the body sends all these chemicals and what they call chemotactic factors and platelets to the area of damage. Well, what do you think happens when all those things get to that area of damage? They can block the artery. They're trying to help you, but they're blocking the artery because all these platelets have now formed a clot. And now there's a clot in the artery just because you damaged it from smoking, from too much carbon dioxide. So
I think as we start to wind down, I think the most important thing is lifestyle can be a great medicine and reverse some of these problems that we've talked about today, right?
correct. Especially as physicians, they have to work on patients is say, look, what is it you enjoy doing?
Yes.
Okay.
Find that passion.
If you want to keep doing that, we have to get you from this point to this point so that you can keep doing it. Otherwise, you're going to get to the point where you're not going to be able to do this activity or whatever. I said, even for, say, someone who's a golfer, you keep doing this, you're not going to end up being able to golf anymore. You're going to have to give it up.
Right.
And as soon as you tell somebody they have to give something up, maybe that strikes fear in them, or maybe it just, a light goes off and says, oh, whoa, I better do this. I better start.
My favorite story, and God bless him, as you know, you knew him so well, and my dad passed away back in 11. But my favorite story is when he had his aneurysm on his abdominal aorta, which was a genetic. He couldn't help that. So they told him after he had the surgery, though, that it would be like a year before he could get back on the golf course. Well, that was totally unacceptable to him. So needless to say, he was on doing whatever he had to do, and he was bound and determined he was getting on that golf course in 6 months, and sure enough, he did. And he was saying, it's well worth that motive. But the point being, that was the motivation.
Exactly.
That's like, I'm going to do everything I need to do to make sure that I can get back into my game.
And I think that's the whole key. If we can motivate people as to why they should do this, then we can alter their lifestyle.
And then I like the buddy system too, because after you've been through it and you've had to do it, you understand it's a difficult journey. You can help others around you. And then you can start the domino effect. And even if you can only maybe influence one other person and get them to make a change, to be a little bit healthier. And you start to build that community around friends and family. And it helps others not to fall, it helps you not to fall back too. I think we could be a much happier society, and a much more productive society, and a much healthier society.
Right.
You're amazing. I thank you so much.
Welcome.
We'll do it again.
Okay.
Thank you so much. And thank you for watching. I'm Mary Pepino, my dear friend, Dr. Michael Lileas, and this is Fit for You.